You're listening to Precinct 444, a podcast network from the National Law Enforcement Museum. Today we're bringing you an episode from the Encore series, where we revisit past museum programs and conversations. I'm Charles Fulcher. Today we're heading back to October 7th, 2020, when we hosted a virtual panel discussion entitled Crisis and Homelessness Intervention Strategies. The program was originally inspired by the depth and severity of the nation's homelessness crisis, made even more apparent by the coronavirus pandemic. As first responders, law enforcement officers are frequently dispatched to address situations involving homelessness-related health emergencies or public safety challenges. Lack of access to regular care for mental and physical health conditions and substance abuse disorders among people experiencing homelessness can lead to frequent 911 calls and law enforcement interactions. Left with few options but to arrest, disperse, or issue a citation, many officers experience frustration at what amounts to a revolving door between homelessness and the criminal justice system, a cycle that disproportionately affects people of color. Collaboration between law enforcement and community homelessness services is needed to better address the core issues at hand. This panel discusses how the support of these collaborative efforts can help law enforcement better understand unsheltered homelessness while reducing related contact with the criminal justice system. We felt that this program was important to revisit, as homelessness, especially in the wake of the continuing coronavirus pandemic, is an ongoing issue. And in many jurisdictions, law enforcement officers often act as the initial providers of assistance, even as they walk their daily beats. Hearing strategies for combating this continuing issue from seasoned practitioners actively working to assist the most vulnerable in their communities is one way we can help make our communities safer, not only for its citizens, but also for the officers and public servants to whom we look in our time of greatest need. In this program, you'll hear from a stellar team of participants. Our moderator, Habsi Kaba, Director of Crisis Intervention Teams, Miami-Dade County, Florida, and Police Mental Health Collaboration, and panelists Sergeant Aaron Dahl from the Vacaville, California Police Department, Eric Weaver, Executive Director and Lead Instructor for Mental Health and Homeless Intervention, a 20-year veteran of the Rochester Police Department and founder of their CIT program, Bo Hall, Homeless Liaison Specialist with the Miami Beach, Florida Police Department Homeless Resource Unit, and Michael L. Farrell, Executive Director for the Coalition for the Homeless in Washington, D.C. Without further ado, may I present Crisis and Homelessness Intervention Strategies.
Joining us today is Sergeant Aaron Dahl from Vacaville Police Department in California. Sergeant, how are you today?
Good morning, how are you?
Very good, thank you. Sergeant of Vacaville is, that would be Sergeant Dahl with Vacaville Police Department, is currently assigned to the Community Response Unit known as CRU, who is responsible for the homeless response. He was born and raised in California, where he pursued a degree in criminal justice and began his career in law enforcement with BART Police Department in Oakland, California, and later transferred to Vacaville PD. Sarge, it's such a pleasure to have you here today. And myself as a mental health professional and working with law enforcement for 17 years, I've had the privilege of working side by side with law enforcement, and it's truly been a real eye-opener to see the challenges that police encounter daily. I mean, truly, I didn't understand any of it until I started working with law enforcement. You've been the lone responder for persons who are homeless and with mental illness for decades now. I was hoping that you could walk us through a day in the life of a law enforcement officer during COVID-19, responding to a person who is homeless. What does that look like? And what is your role of the community, in the community as a responder?
Okay. Well, thank you. Like I said, I supervise our community response unit. So there's myself, normally three officers that work with me. We've actually had a couple of our youth services officers working with us over the past 8 months because of COVID and the schools being shut down. And then we also have our homeless outreach workers that are case managers with one of our local homeless shelters in Vacaville, the Opportunity House. And so we have them out with us on a regular basis as well. We usually start our days, especially in the summertime, very early, about 4 in the morning, so we can get out there as early as possible and maximize the number of contacts we could make. Through COVID, I mean, it was kind of business as usual. We would go out and make as many contacts as we possibly could with the homeless. On the In the early stages of COVID, we were just making sure that they were aware of what COVID was, the potential risks of it, how to safeguard themselves from the disease, and just offered some tips and just make sure they were aware of everything that's going on. They don't have the luxury of media outlets that most people have. And so we just have to make sure that they're up to speed on what's going on. Here in Vacaville, we're a community of 100,000 people with roughly 100 chronic homeless individuals that we deal with on a regular basis. But we're kind of fortunate where we don't have the high density um, housing that the homeless use that you see in a lot of larger cities. Our homeless do congregate together a bit, but also they stay kind of spread out. They don't all stay in one place. They're spread out amongst different parts of town. So they're not right on top of each other where you run the risk of not social distancing. So we have a little easier time dealing with the homeless as far as COVID goes because of how they operate on a daily basis. But as far as our outreach and how we do things, I mean, it was business as usual. We know all of them by name. We go out and talk to them on a regular basis. We know their stories. This isn't anything new. And, we just continue to try and work and problem solve with each and every one of them. They all have different issues. There's probably a different answer to trying to help them succeed. And, we just continue on with them. Sometimes we come across somebody where it's a pretty simple solution, but a lot of them, it's just very, very complex. And you're not going to solve this problem or win this war in one day. It takes, days and months and sometimes even years of, ongoing communication and problem solving with them to try and get them to get over that level of fear to take that next step and to try some type of shelter or accepting some type of resource.
Mm. As far as your case managers, are these mental health professionals, crisis counselors?
Um, the one thing, this has been a very humbling experience, being able to work in this unit because I've been able to no longer just work with police officers, but I get to interact and work with people such as yourself and all these different members of the community and different county-based organizations. So the way we have it structured is, I have three outreach workers that work for the Opportunity House. They are not mental health professionals, but all of them have a background of, being homeless, living out on the streets, serious drug addiction, selling drugs, living behind dumpsters. And they've been able to go from rock bottom to getting back on their feet. So it's been such an incredible experience to be able to use these people to come out there with us because they know how to talk to these people. They can, call them on the things that aren't truthful, and they could tell them and relate with them that, hey, I've been you. I've lived behind the dumpster. I've eaten out of a dumpster. I've refused phone calls from my kids. But you can beat this and you can get back on their feet. So we use them to kind of build that bridge and the relationship. But we also do work, like yesterday, I had two people from county mental health come out with me. And on days like that, we target the people with severe mental health and we try and get them to accept resources. So depending on the day, depending on who I have with me, is the type of person we target and perhaps the type of help we offer. So I have to, I mean, you realize in this job, it's not just one person is going to make you successful. You need to learn to collaborate with all sorts of different agencies and different people and find out what combination of people at that given time is going to get through to this person and lead you to some type of success.
Well said, Sergeant. It takes true collaboration, and we need to get out of our silos and realize that we can't do it without each other. Thank you. Thank you so much, and thank you for your service, Sergeant.
Well,
With
thank you.
Thank you. With us today as well, we have Eric Weaver, who is a highly decorated retired sergeant with Rochester, New York Police Department. One of his many assignments was serving as a mental health coordinator, and he was the creator and developer of the CIT, Crisis Intervention Team Program, and the commanding officer for his department in New York State. He is also currently a member of the National Alliance on Mental Illness, NAMI, Consumers Affair Committee. And I know that you are very dedicated as well to officer wellness, and you have a book coming out in the fall. Eric, thank you so much for joining us.
Thank you.
Please.
Thank you very much, Hamzi.
Thank you.
Well,
Thank you. And with your past experience as an officer and now as a trainer, bringing everyone together, involved with NAMI. You play so many roles now, and that is what it takes. Can you please just give us a little bit of insight into your role with this collaboration combating homeless?
Sure, absolutely. Once again, thank you so much for having me. Very, very highly appreciated. Very honored to be part of this. Back in 2002, 2003, Rochester experienced some very difficult challenges, and we went on to realize that we needed some kind of training with police officers in mental health and homelessness and all that. And I put together an advisory board, about 30, 40 of us, 50 of us, from judges to jails to legislators. And I said, you know something, for all these years, because I started in 1983, a long time ago, I said, for all these years, it's been the police and all the rest of you people. We don't talk to you and you don't talk to us. So my job, whether it's about arresting somebody for dealing drugs or your job about someone who's mentally ill, is about people. And oftentimes it's about the same people. So why is it we're not talking to each other? And so that was a huge collaboration to realize why we have these two entities dealing with the same people that aren't having any conversations. So we opened up those conversations, we opened up those things, and it really started our CIT in 2004. First was kind of New York State, which we're very, very excited about, and put together lots of CITs throughout the country too. One of the things that I talk about quite a bit is the issue surrounding stigma. And the issue surrounding stigma and having someone who I am mentally ill, I'm seriously and persistently mentally ill. I've been hospitalized 9 times over the last 24 years, 6 times as a police sergeant. So I know mental illness very, very well from a personal perspective, as well as a consumer and police perspective as well too. And when you look at the issue of stigma, especially in regards to homelessness, you have 2 stigmas involved. And we know the regards of homelessness and the percentage of the individuals who are mentally ill as well too. And then the stigma of being homeless as well. When you look at the stigma surrounding mental illness, of being society's words of crazy, nuts, and schizo, and whack job, and all the kind of stuff, and then the stigma surrounding homelessness, it's an amazing thing. As I was just quoted in Newsweek last week because of all the things happening in Rochester lately, and I've said this every time in all of my schools that I taught around the state, is mental illness is a medical condition. Mental illness is a medical condition. I said so many times when I talk with about homeless individuals, is imagine knowing that mental illness is a medical condition, and oftentimes the mental health issues surrounding homelessness are one and the same. Imagine if we had 30 undiagnosed cancer patients living under a bridge. We would have society, we would have agencies just bombarding people. People would open their homes to them. They would be, so instead of having people who have cancer under bridges, we have people with other mental illnesses, other medical conditions under bridges. And it's like the stigma just around mental illness itself. And then we wonder why, why don't they go get a job? And why are they doing this? And tell somebody who's hearing 3 or 4 voices at the same time to go fill out a job application in McDonald's. It doesn't work. It doesn't work. And one of the things that I instilled with my CIT officers, I gave them one assignment one time. Every time I'd give them an assignment. And I said, what I want you to do over the next couple of weeks is because Rochester has a very large homeless population. I said, what I want you to do is pull up to someone who's homeless or talk to someone who's homeless. And all I want you to do is ask them their first name. Don't ask them their last name or their date of birth, because they're going to think you're running them for warrants or something, right? So I said, all I want you to do is ask them their first name. And then I want you to ask them this: what brought you to this point? and story upon story upon story upon story of doctors who lost their homes for insurance reasons, and then the wife left, or people that have been brought up in very abusive environments. And it brought down the stigma. My CIT officers had a tremendous amount of understanding of mental health anyway, but it brought down the stigma of the homeless population so tremendously when all I asked them to do was ask them their first name and what brought you to this place.
Yeah,
It was absolutely amazing. So working with the consumers and working with mental health and working on both ends of the mental illness part of it and the police side of it has been quite a journey. So thank you.
No, thank you. That's so profound. It truly is when someone just shares their story, and you find trust and rapport through that conversation. And that's what we know that CIT is all about. And for our viewers that may not be familiar with CIT, with crisis intervention teams trainings, you can go to citinternational.org and you can learn all about CIT. We have a implementation guide, how to get your program started. And I can see, Eric, your passion and dedication to the commitment of training and education for our officers.
Thank you.
Necessary, and thank you so much.
Like I said, especially when it comes to stigma, like I said, I can't emphasize enough that it's a medical condition, and if we had 30 people with cancer under a bridge, the response would be a lot different, and we probably wouldn't even be having one of these seminars. So that's a huge challenge that we continue to battle as a society, let alone in law enforcement. So
fighting stigma, absolutely. Thank you so much, Eric.
Thank you.
Thank you so much. And, I'm so very excited to be sharing this platform with Bo Hall, who's with the Miami Beach Police Department, led by Chief Rick Clements. Bo is the first ever homeless liaison specialist with the award-winning homeless unit, also known as the Dream Team, in Miami Beach Police Department. He is a CIT certified, not officer, but like one, mental health liaison and a Florida certified recovery peer specialist. While living at the Miami Rescue Mission for 3 years, he pursued his education and graduated from Miami-Dade College as an EMT paramedic. Bo is well known in his community for his relentless work with those who are homeless, and above all, his personal story of recovery and inspiration. Bo, so great to have you here today. Thank you for joining us.
Thank you for having me. On behalf of the Miami Beach Police Department, Chief Richard Clements, Deputy Chief Wayne Jones, Assistant Chief Paul Acosta, Sergeant Jerome Berrien, and my Homeless Resource Unit family. Yes. It's an honor. Thank you.
Yes, we could just go on, and yes, absolutely praising each of all our panelists, supporters, and leaders within our communities. Bo, government leaders, organizations for the homeless, and society, we talk about problem solving and strategies in combating homelessness, but we fail to include those who are homeless in the solution. You've lived the streets. You are those individuals you serve daily. Please help our viewers to better understand your experience, what your role is now. We would love to hear from you, Bo. Tell us.
Well, ever since I was an early teenager, up until the age of 28 years old, I myself was chronically homeless in my hometown of Miami Beach, Florida. And back then in the 90s, there wasn't a homeless outreach team out here. There wasn't a Miami Beach Homeless Resource Unit. There wasn't a homeless outreach team for the city of Miami Beach. And growing up, I ended up turning to drugs and alcohol. I ended up committing crimes. I was that same person that found myself sleeping at bus stop benches and on the beach and parks, nowhere to go to eat, wearing the same clothes for months, not taking showers for weeks. So personally, You know, I've experienced everything that the same individuals that we serve and try to help off the streets today experience. Um, I feel, you know, exactly what they're going through, and they know that. You know, many of the homeless in the streets of Miami Beach, they know my story. Many of the homeless on the streets we were homeless together, and they're still homeless. Um, and you know, it's pretty innovative and life-saving. It's amazing what the Miami Beach Police Department, you know, have done some 6 years ago with creating this unit. You know, creating a sergeant, creating homeless resource officers, and for over 6 years now, we've been successful in getting hundreds of homeless individuals off the streets. And as well as getting individuals um, living a life of recovery and stability. I'm just honored to be a part of this.
Yeah, Bo, and I know that you lead, you know, when once the scene is safe, you are the one approaching, the officers, you know, stand back, and I mean, I've witnessed it, and it's a beautiful thing to see how some individuals will accept services. Can you tell us, and this is a question that, you know, is always asked, and I myself, you know, what are some of the reasons you find that some individuals will refuse shelter or, you know, emergency homeless assistance?
Well, you know, mental illness, substance abuse, this is major factors why many of our homeless are homeless on the streets for many years. You know, it's a battle that you know, we have to constantly deal with. Um, Providing hope, encouragement, constant engagement, you know, is the key. Something that we never stop. Many of the homeless individuals here in the city of Miami Beach, we've assisted many of them with shelter. We've assisted these individuals with drug and alcohol treatment program, mental health services, but they'll end up right back. It's just a matter of never giving up on them. And that's something that my colleagues and I, we don't do. We don't give up on individuals. And it's the same thing like Sergeant Dahl said. You know, what we provide is that love, compassion, and empathy. And we're out there conducting street outreach every day. And just like Sergeant Dahl and his team, we are out there 3, 4, 5, 6 a.m. in the morning every week. And we've been doing this for years. And I think for us, what's been the key, what's been the beautiful thing here in Miami-Dade County and in the city of Miami Beach is we collaborate, we team up with our homeless outreach team. We team up with our Miami-Dade County Homeless Trust and our homeless providers in the continuum.
Yes.
We team up with Judge Steve Leifman, jail diversion,
Yes.
the courts. And so it takes a team effort to make the dream come true.
Absolutely, and also CIT platform
That's right.
brings those partners together, and that's
That's right.
the board in the nation. So viewers, if you're asking yourself how, you know, definitely, you know, reach out to your local police department. Do they have, you know, a CIT program? Reach out to the National Alliance on Mental Illness. Reach out to CIT International. Reach out to our panelists here who have a wealth of information. You will find, you know, their bios in the information sent to you. You can reach out to them directly. And with all of that, Bo, tell us what needs to change. What do our government leaders, what does Congress, what do they need to hear? What do we need to take this to the next level to help our home?
I mean, you know, ending homelessness to itself is complicated. You know, many are homeless behind mental illness, substance and alcohol abuse, criminal related convictions. You've got folks that simply just want to be homeless. It's a lifestyle choice. But with that said, I don't think we can end homelessness without collaboration and teamwork with our homeless providers,
Yes.
our outreach teams, our behavioral and medical health systems, our law enforcement, and our criminal mental health courts, such as the jail diversion program. We need to look at this in the context of providing personalized solutions for each individual. But perhaps I think one of the biggest challenges is socioeconomic, and which can be simply addressed by providing low to no income for people who can't afford it. And that's something that can be done.
Thank you so much, Bo, and thank you for your commitment to the cause. And with that, speaking of collaboration, also joining us today, we have Michael L. Farrell, who is our Executive Director for the Coalition for Homeless in Washington, D.C. Michael has 40 years of experience in public service, including the D.C. Department of Employment Services, former D.C. Commission on Social Services, and the Council of Churches of Greater Washington. Michael, thank you for joining us today. It's a pleasure to have you.
Well, thank you for having me.
Absolutely. Can you please shed some light on some of the concerns as well that you may have, and also very importantly, the strategies your organization has implemented since COVID? That would be great to hear from you.
Well, thank you. In Washington, D.C., certainly because of the pandemic, we've had to have a citywide strategy in order to address, the issues, in addition to being homeless, but worrying about, COVID-19 in and of itself. And so what the district has done is a number of things. One thing it has done is created what we call isolation and quarantine units. These are hotel units that are being utilized to isolate and quarantine individuals, both in the general population as well as in the homeless population, who are either being tested for COVID, so they're in isolation units, or individuals who have tested positive, and those individuals are in quarantine units, receiving treatment. And so those are two critical tools that are being utilized in Washington, D.C. at this time. The other is geared towards prevention. And so we have some specialized units, we call them PEP-V, which stands for, I have to read this because it's long, Pandemic Emergency Program for Vulnerable Individuals Experiencing Homelessness, shorthand PEP-V. And the V is for vulnerable. The PEP-V units are also hotel units where individuals who fall into the high risk categories, either age or other chronic health issues, are placed in hotel units so that they can be safe from possible infection by COVID-19. And so that particular strategy is working well within the homeless population. Another unit is expected to open in Washington October 12th, to be exact, that should add an additional 115 units, that are targeted towards homeless individuals, but most importantly, homeless individuals to prevent them from possibly getting COVID and subsequently spreading it throughout the community as well.
That is great information and resources. I myself will be reaching out to you. We'd love to learn more, and I'm sure our viewers are very interested as well. Thank you for that, Michael. Thank you so much. I'd like to welcome Tanisha Hildbrand. She is the Crisis and Veteran Services Administrator for Mercy Care, which is the Regional Behavioral Health Authority for Maricopa County and parts of Pinal County in Arizona. Tanisha oversees a system that serves over 4 million people and includes a central hotline, crisis mobile teams, urgent psychiatric centers, a respite, detox, and transition facilities. As well, an Army veteran, she works closely with local law enforcement and the Veterans Administration, hospitals, fire departments, and community crisis providers. Tanisha, thank you so much for being here today. Please share with us some of your wealth, your resources, strategies that you have implemented and are in place at this time.
Thank you for having me. It's a pleasure to be here among so many just wonderful agencies and resources that exist in the world. You know, you sort of go about knowing what exists in your own community, and so to be able to share in this way is exciting. I too learn. Our crisis system has been very robust and accessible pre-pandemic, during pandemic, open to everybody, no wrong door for law enforcement. We have such strong partnerships with all of our local, state, county, federal, and tribal law enforcement agencies that we really try to work through any challenges, any issues, coordinate better, make it easier for law enforcement to drop individuals off into our facilities or hand them off to a mobile team or a crisis line. Our mobile teams all of our crisis system has remained fully functional 100% throughout the pandemic. We recognize that while some of our outpatient resources have relied on telehealth, it's important for us to be able to go out into the community, take over care for somebody, get law enforcement back out into the community to serve those other calls for service that don't really require, behavioral health in those. And then we can serve that person, figure out what the underlying challenges are, connect them to ongoing care. I think COVID presented a lot of challenges, and we've learned as we've gone along, having enough PPE, testing abilities. You know, we say no wrong door, bring anybody into our facilities. And often somebody may not even know that they're not symptomatic. They don't know that they're positive. We may not find out until after they've transitioned to another location. So a lot of good coordination between our crisis facilities, our hospital systems, so that we can identify those individuals who do need either a higher level of care, ongoing treatment, back out into the community. We recognize that when somebody is not doing well, the first person, the first entity that gets called is law enforcement. So we want to try to make it as easy as possible when those calls do come, whether the calls can get diverted into our crisis line, our mobile teams can go out, our facility is completely available, and then really do work to try to resolve some of those other issues that lead to chronic homelessness or other challenges that the person is experiencing in their life.
Okay, fantastic. Thank you, Tanisha. As well, viewers, you'll be able to reach out to Tanisha if you have any further questions. You have a big job, and I want to thank you so much for that. Last but not least, we have the lovely Mary Frances Kenyon from Edgewater, Maryland. Mary Frances is a lead homeless services specialist at a consulting firm with over 13 years of experience working towards an effective homelessness crisis response system and creating a more equitable system of care in response to homelessness. Mary Frances, what would you say are some of the risk factors to homelessness? I know I haven't asked that question to any of our other, maybe for a loop though.
Oh, okay. Awesome. Good question. And thank you for having me. It's an incredible opportunity to be around such a vast group of experts in their own right. So first I want to start out by saying, and putting homelessness into context, right? People experiencing homelessness are humans first. They're someone's brother, someone's mother. And I think many of the panelists spoke to that. They could be a former neighbor, a former colleague. So I would just ask attendees that are listening in, imagine someone closest to you becoming homeless and living in a park or under a bridge and in an alleyway. And I'm glad you asked about the risk factors, Hopsy, because you actually spoke to this a little bit when you were introducing panelists. But there are some commonalities with COVID, with the justice system, and with homelessness in terms of disparities. And you were talking about some of the data. The nation's data actually shows that Black Americans are 3 times as likely to experience homelessness as a general population. But Native Americans or Indigenous people are 4 times as likely. And unfortunately, Pacific Islanders are 9 times as likely than the general population to experience homelessness. So in one sense of the word, your race or ethnicity is a risk factor for experiencing homelessness. Again, there are shared disparities across the justice system, who we're seeing that is being deeply impacted by COVID-19 and the pandemic, among other sectors. I think that you can't look at homelessness as just as having serious and pervasive mental illness or co-occurring disorders or substance abuse, although we do see that in our population. There are other factors like child welfare involvement, a history of domestic violence, whether that be intimate partner abuse or familial violence. You have other economic factors that can contribute to the risk of someone becoming homelessness. And just in general, I think it's important to note that it could be anyone, right? We're one disaster away, one more pandemic away from you or I experiencing homelessness. And I think it's important to relate that to the human side. Speaking back to the stories that some of the other panelists shared, these are folks that are human.
Yes, and the more time we spend, if we spend any time on the streets, the greater understanding there is, and compassion, and education being so necessary. Thank you, Mary Frances, so informative. And I see so many questions coming in now, and I would like to open up those questions from our viewers to our panelists here. And so let's see, we have our first question from Chris Colas. I wonder, and it's for any of our panelists, I wonder if part of police training, if new police officers would be required to spend their first few months on the force serving on a homeless unit like Sergeant Dahl does to sensitize them to the real situations in the community. Is that happening anywhere? No gun would be assigned to the officer until the homeless service was completed. Kind of like a little internship. I don't know that, do any of our panelists or Sergeant Dahl, do you know of any?
What we do here in Vacaville, now granted, once they get off of out of the academy and they start training, yes, they do have a gun with them because they are police officers. And even when we go out and do homeless outreach, you never know what we're going to come across. So that's really not an option. But what we do with all of our trainees is they usually spend at least 1 week or 2 weeks with one of the officers on my team doing strictly homeless outreach in the morning, just to kind of open their eyes to what we do, kind of some of the things that we're dealing with, and let them see what it's like to deal with people with, mental health and drug addiction, the resources that we have to offer and what we do and the links we do to help these people. That way, when they leave us and they go back to just normal patrol work, probably in the middle of the night on graveyards because they're brand new, they have some of these ideas in their head on how to help these people. So we're trying to give them a little bit of the knowledge that we have. That way they can go out and make a difference in the middle of the night when we're not around to help. So we try and teach all of our new officers that.
Yes. Yes, and so in my own training with law enforcement, which, for all our civilian viewers, I highly recommend that you do a ride along, of course, when COVID is over, and you're going to learn so much. And so for those of you that don't know, all law enforcement officers go through the field training, right? Officer training for a certain amount of time. And so that's the real, get on the streets and learn experience. So
Absolutely. If I could add just one more thing as well too, is that when when officers, a lot of the issues are surrounding staffing. Having something like that would be very difficult. And for a lot of people have a kind of a misunderstanding, a misnomer for most CITs that they're a full-time team. Those officers are still responding to burglaries and robberies and parking complaints, those kind of things. And when calls come in that meet that dispatch criteria, then CIT officers go. So a lot of departments, we have tremendously small departments all around the country that just staffing wise, it would almost be impossible to have that happen. So it's a challenging thing. It's a challenging subject. In our mission statement with my CIT was, and it came out, it went around the whole department, is that every individual CIT member will treat everyone they encounter with dignity, compassion, respect, and understanding. That was the last sentence of my mission statement, which went throughout Rochester. So too, as well as understanding and having that input from the academy. We went from 16 hours to 24, which is nothing in regards to actually training on mental health and mental illness. But we really try to instill the continued compassion and care of everyone involved, including the law enforcement officers who are struggling with their own stuff. And so that's an important thing as well too.
Yes, yes, very important, very important. And also, Tanisha, you had mentioned that you have a resiliency program for officer wellness. We're taking care of the community. Our first responders need assistance as well.
Yeah, thank you for mentioning. Throughout all of our CIT training, we always incorporate an officer wellness component. But as the pandemic went on, we recognized that our first responders, our healthcare workers were really just being impacted by the trauma. And so rather than the typical debriefing or critical incident stress management, we developed what we call deliberate resiliency for frontliners, to really address that trauma is just so very inherently part of first responders and our healthcare workers, and trying to support them through that process and being as resilient as possible through traumatic events.
Yes, thank you. Thank you for that, Tanisha.
Popsy?
Yes, go.
I'm very proud to also announce that my homeless resource unit colleagues and Sergeant Jerome Berrien, we provide post-academy trainings to our new officers. And we've been doing that as well for years now.
Yes, thank you. Thank you for that. And also your Lieutenant Taylor, Dr. Taylor,
Yes.
Heads the peer support program for.
She's amazing. She's amazing.
More and more peer support within our police departments. Yes, thank you. Very important to mention that. Our next question is from our viewer, Stephen Van Zanten. Are the units opening up in DC? If so, where and when will it be opening? Where and when?
I'm assuming he's asking a question about the PEP-V units. The PEP-V units are actually open now. Additional units are going to be brought online around October 12th, but there are units that are fully operational as we speak. There is a referral process, that the district has in place. And so if you could have the individuals asking the question to put something in the chat, I can forward them information, regarding the referral process.
Thank you, Michael. Thank you very much. Our next question is from Elizabeth Wallace to Mary Frances Farrell. Do you have staff on duty at the hotel units for high-risk residents to make sure they are practicing mask wearing, social distancing, etc., both on the property and when out during the day? What do you do if residents don't comply?
Well, short answer is the PEP-V units are fully. Did you want me to respond?
Oh, sorry, Michael. It was for you. Yes, not Mary. I apologize. Yes, go ahead, Michael.
Okay. The units are fully staffed 24 hours a day, 7 days a week. Certainly, their behaviors while they're they are actually within the facility, are closely monitored, but individuals, do have the ability to leave the facility. So we certainly can't monitor their behavior once they leave the facility. The one thing I also wanted to mention in terms of what's happening in the district, and I make a very broad assumption that that's pretty much all universal standards, is we're doing the screenings upon entry into all of our shelter facilities. So we have this CDC screening questions. We're doing temperature taking for individuals when they enter the facilities. And to ensure social distancing, we've actually downsized facilities. So facilities that, for example, that had a 300 bed capacity was downsized to 220 beds in order to ensure social distancing, to protect both the clients and staff in those respective facilities.
Thank you, Michael. Thank you very much. Our next question is from Catherine Johnson. In my city, camping is illegal and not allowed, which is how most of our homeless community lives. I'm tasked with asking them to move along and explain they can't camp or live in the woods. I do give them my card and offer my help in getting them into housing. However, most of the time they do not call me. They just pack up and move to a different spot in the city, or sometimes they just wind up walking around the streets and sleeping on benches, which just winds up upsetting non-homeless citizens and our city manager. Does anyone have any tiny houses communities? If so, were you able to get any kind of funding from the government to build this area for homeless citizens? Great question. Or any other type of housing from our panelists?
So, Hapsi, I'd like to speak to that question, if I might, and I'll try my best to answer all parts of the question. I think when we talk about homelessness and justice involvement, again, there's that commonality. Like, we don't want people to have justice involvement, and we also don't want them to experience homelessness. There's definitely a growing body of research that compares the cost of homelessness, which includes any type of criminal justice involvement, with the cost of providing housing to people that are experiencing homelessness. And it shows that housing is the most affordable option, right? Criminalization doesn't prevent or end homelessness. And in fact, after people are given a citation or arrested, they return to the community still experiencing homelessness. So it's a no-win situation for the homelessness and housing sector, nor the criminal justice sector. Additionally, criminal convictions can create barriers to obtaining public benefits, employment, and housing, especially when there's that cyclical nature that we often see in homelessness, where folks are bouncing around between the streets and jail and maybe a detox facility. But I think my final point would be, it's not the best use of law enforcement time or resources, nor taxpayer resources. So a part of the solution that I would offer to the person with the question is to change the narrative about homelessness in general, and to access some of the federal and state resources that are available. There are some great subsidy programs out there that can be tailored to the needs of an individual. It could be our rapid rehousing funding, which there's a pretty substantial federal investment in those programs, are also permanent supportive housing that would probably be more closely aligned for the folks who are unsheltered and on the streets, and kind of are who we deem as our frequent flyers in various sectors.
Yes. Thank you, Mary Fran. Appreciate that very much. Our next question is from Rachel Wright. It's for Sergeant Dahl. Sergeant Dahl, with the COVID restrictions in place, what options are you making available for the homeless to access services if they cannot do it in person?
As far as that goes, I mean, our mindset has always been, we explain the services, but if the homeless individual truly wants the services, I always bring the services to them and don't send them to the services. They're easily sidetracked at times. And so we you have to strike while the iron's hot. So if they're willing to try something, it always works best, at least in our community, to bring the resources out to them. So, I mean, I have some of our people that provide resources, county workers. I mean, I drag them down into the creeks and I take them all over the place and up the hill and down the hill. So COVID to me doesn't really impact a lot of the resources because we're always trying to bring the resources out to them. Some of the people that we have tried to get into shelters, you know, there are some restrictions with COVID, and I've just kind of been creative, and I've used some motel rooms that I have access to kind of set up my own self quarantine and get them tested. And then once they're tested, I can rapidly move them into a shelter after the fact. So
Yeah.
I hope that answers.
Yeah, no, very well. And you know, as Bo mentioned, it just takes, you know, consistency, never give up. And I know that's pretty much what you end up doing, just seeing the same, as you mentioned, you know them, you see the same people over again, and just keep asking, keep offering. That's really, you know, great advice. And I know it becomes more difficult with individuals who are living with substance abuse. And, you know, they may be ready today, and then they have those cravings and feel that they, you know, they can't do it. And then many times they don't respond, you know, to you or follow up as well. I know that, Bo, you mentioned the homeless resource unit, and as well, when you're working with substance use and abuse, you have what we know in Florida as the Marchman Act, which is the Substance Abuse Act. And in Miami-Dade County, I know that if you could speak a little bit about that, your team will actually identify those individuals they have no family, no one can petition for involuntary assessment or services. And so the homeless resource unit ends up being that person's family and petitioning for an assessment. Is that, yeah?
So we started that back in 2006, where we will file a petition for a Marchman court hearing for a John Doe who's chronically homeless on the streets of Miami Beach, who's addicted to alcohol or substance abuse, oftentimes severely mentally ill, constantly getting arrested and picked up for substance or alcohol related offenses. We're constantly, transporting and taking that individual to detox and mental health emergency services, and it's not working. So back in 2016, what we began doing is filing a petition to go in front of a judge to get that judge to mandate that person into a drug and alcohol treatment program. I am beyond proud to say that what started back in 2016, today, we've been able to get 38 individuals into treatment and off the streets of Miami Beach. And that's something that right now we've even began training other law enforcement agencies throughout our nation, exactly on how we are literally saving lives.
Yes, yeah, it certainly takes a village, and housing is a big component of that, just having our basic needs met. And so with that, we have a question from Lauren Sidney for all panelists. Do you have experience with Housing First programs for homeless communities? And what is your opinion on how effective they are? Has anyone heard of Mary Frances?
I can speak to that. So, you know, homelessness as a whole is undergoing a pretty large transformation and converting to the Housing First model. And some of you all might panic when I say this, but Housing First is simply putting folks in housing, regardless of whether or not they're an addict, an alcoholic, how many children they have, what their criminal barriers look like, how many evictions they have. The idea supports that when you put a person into housing without any preconditions like sobriety or drug testing or alcohol testing or mental health services, that they tend to do better and be more successful, right? So rather prescribing to someone what they should do and how they should do it, really allowing them to have choices, right? And showing them what the consequences for the different choices that they make look like, and allowing them to gradually grow into the decision to access treatment or access behavioral health services. And I think if you were to look at our national data, with the exception of the rise in homelessness that we've seen in the state of California and some moderate increases in other states, if you're looking over the last 8 to 10 years, there's been a decline in homelessness overall. So that shows me that Housing First is working. Targeting the resources that are coming through the federal government is working, but Housing First doesn't work by itself. And I want to speak to something that Bo was talking about, that collaboration, the coordination. Homelessness is solvable, right? Housing is the least expensive option across all of our systems. But it really takes having those multi-sector partnerships, and beyond law enforcement, behavioral health, we have to look at the housing sector. We have to look at the employment sector. We have to have really deep and meaningful partnerships across school systems, the education system, the child welfare system, the domestic violence system. So I would encourage any community that is looking towards promising practices and solutions to explore Housing First. But before doing that, make sure that there's a strong foundation of partnerships that are well connected and very meaningful with a shared goal. And again, the solution to homelessness is housing, right? We can start helping people fix areas of their lives that they want to or that might be broken after they're in housing, because it helps us all out and it helps the community all out.
Yeah. Yes.
Totally agree. Totally.
Agree. If I could mention one thing, for all the decades I've been in law enforcement, there was no such thing as Housing First. It was simply jail first. And because there was no real options, there was no, what do we do? And working so much with jail diversion programs, jails and prisons, as you all know, are now the most populated psychiatric hospitals in the country. The amount of individuals who are in jails that should not be there is just astronomical. With the deinstitutionalization of mental health facilities, those kind of things, mental health hospitals populations have dropped, jail and prison populations have exploded. And so I think it's a wonderful, wonderful opportunity for the Housing First to be such a valuable part of that, because for decades, like I said, we didn't know what to do. Now working with Salvation Army and Open Door Mission and things like that, working diligently with those programs, because you have a lot of officers that simply just didn't know what to do. And so the only thing they did know what to do is take someone to jail. Now there's so many different alternatives. It's really, policing itself has come a very long way in regards to what it was in the 80s and 90s, and even still got a long way to go in 2020. But I think that's an important part of what we're trying to do with jail diversion and mental health courts and those kind of things.
Truly, truly well said. And so much is, dependent on law enforcement. And we as a mental health community and societies have to take ownership and provide the tools that law enforcement need to provide more services. And they shouldn't be providing any services, but assistance and linking them to services, which was a question from Paula Barker. I'd just like to elaborate on what she's asking here so we can further talk about it. Is there a move toward creating or training units of police officers to specifically handle mental health cases to prevent criminalization of homeless persons? And that is where our jail diversion programs come in, but as well this movement of CIT expansion with co-responder models and embedded models within police departments, but really it shouldn't fall on the shoulders of law enforcement. Panelists, could you share any best practices or models that you're aware of within law enforcement or even better, outside of law enforcement, where mental health is partnering with law enforcement to assist our homeless and people with mental illnesses in our communities?
I'd like to respond to that if I may. We've been fortunate enough to try some different pilot programs to see what works best. We have one program where clinicians are riding in vehicles with officers. One of our city's Mesa Police Department, they have a crisis response team, and so the licensed clinician is really attached to the team, so she has the flexibility to move between vehicles and the detectives depending on the types of calls. We also have a navigator follow-up, so where somebody is routinely calling for law enforcement, there may not be an immediate need or concern for danger, but there's certainly something going on for that person, and we want to try to help support them. So we have our navigators who can go out and do some of that engagement after law enforcement say, this is the person we're concerned about, this is what's going on. And then we have our mobile team co-response. So either at the point of dispatching communications, getting the call, they can either transfer the call over to our crisis line and not even needing an officer to go out if it's not warranted, necessary, or ask for a mobile team to respond at the same time for law enforcement. So rather than the officer getting on scene and then deciding this is very mental health, I need a mobile team, we can cut down on some of that time, get the mobile team out as quickly as possible, and then hopefully get the officer out of there as quickly as possible as well. We've been doing this for a few months now, so we're seeing some positives. Mesa really enjoys having the clinician with them. They're able to take over some of those calls that patrol is getting, more suicide in nature, and then the clinician can really utilize her skill sets. Mobile team co-response, also very popular and effective for the other police departments.
Yes, thank you. Sounds like a very robust services. And again, would you say, Tanisha, that the key is the collaboration and to access all of these services? And I mean, truly, I believe, because we have a question here is how can I access all of these services and connect? So I do suggest viewers once again that you reach out to any of our panelists here, including myself, to link you to more ideas and initiatives, best practices. Also go to citinternational.org, as well as NAMI, which is the National Alliance on Mental Illness, NAMI.org. These programs are throughout the nation, and they are the leaders and the platform to initiate these best practices and models that are out there. Someone mentioned Elizabeth Wallace. She mentions that she saw the film, The Definition of Insanity, which is a film produced in Miami-Dade County on our jail diversion program, our criminal mental health project. It was featured on PBS in April, but you can still go to PBS or you can Google definition of insanity, and you can access it. It's going to give you a lot of great information, because here it's being asked, is there someone you can recommend that my city council can talk to, so we know how to access all of the numbers needed to assess that for our community? Absolutely. Please feel free to reach out to our panelists or myself for that specific information on the definition of insanity. As well, SAMHSA provides the intercept sequential model on mapping. That's so essential to your community. They can assist you and provide technical assistance in providing a mapping of your community and all of the entities where people with mental illnesses, the homeless, it will be their entry point. And they help you identify what your gaps and barriers are and who your partners are and where to begin. So again, that SAMHSA, the sequential intercept model, there are some great resources out there for all of our panelists here. I'm sorry, for all of our viewers today. Panelists, would you like to add to any of what I've just mentioned? Okay, great. All right, we have a question here from Matthew Lewis for all and any panelists. Why do you think that the general public and many government agencies see homelessness as a police issue? Homelessness is not a crime, even though there are some minor violations associated with the homeless. What are some resources to help educate people see that this is a social issue? Great question. Great question. Would anyone like to answer that?
I think we talked so much about the issue of stigma, and stigma is something that we take lightly, or we really don't even know what that word means sometimes. But the issue of stigma of individuals that are homeless, that are the stigmas of lazy, and why don't they get a job, and all that stigma that is involved in that. And what happens is people in the community say, I drive by every day, I drive by the work and I see these 40 people over here, and why is that going on? And let's call the police and get them out of my neighborhood. And what happens is individuals have no understanding of the challenges that all of our panelists have talked about regarding homelessness. It turns into a police issue because oftentimes no one else knows who to call. And so law enforcement respond. One thing I can honestly say from my personal experience, the vast majority of officers that I know over the many, many years don't want to have someone move along. They don't want to have somebody pick up their stuff and move someplace else. They identify and recognize that this is a very challenging issue. But what happens is communities call, neighborhoods call, the mayor's office calls and said, I got a call, you got to do something about these people under over here. And police officers who know the challenges firsthand are oftentimes in this lose-lose scenario in which they're asking people that they know are decent human beings that are just struggling to go someplace else when they truly wish they could not have to say that, but they're put in these positions that many of them truly don't want to be put into. It becomes such a huge issue amongst the community as far as, once again, going back to stigma as always. That these are individuals, these are human beings, these are people. And I think as Mary Frances or someone said, we're just purely by the grace of God, that's not us. And so I think that's an important thing the community really needs to realize as well too.
Yes, thank you. You're here, Eric. Homelessness and mental illness is not bias. It can affect any one of us. I really recommend to our viewers, NAMIagain.org is all about education, and they provide at no cost free educational training and support to any and all. I really recommend they teach you all about what mental illness is, as well CIT International. So there are many resources through NAMI and CIT International to access some training and as well free training for the community, because we talk so much about law enforcement needs to be trained. Society needs training. Society needs education equally. We are tipping the scales now with training law enforcement. They receive countless hours of training a year. Let's train our community. You too can be a trainer and a supporter. Wonderful. Wouldn't you agree, Sergeant Dahl? I know that inside you're smiling because I get it. I get it. And we want our...
It's absolutely true. And I mean, why the police get involved so much is whenever anyone has a problem, it's very easy to pick up the phone. You can dial 911 or you can call the number to the local police department. And we will, especially, I know in the city of Agville, I'm sure Bo does it, but we will go out and deal with almost any issue. But a citizen can't call mental health and say, hey, there's a bunch of homeless people out here that need mental health treatment. Can you go help them? Or they can't call some type of substance abuse program and say, hey, there's a guy over there who's got a drug problem. Can you go help them? That isn't an option. That's why we end up getting involved as the police, because we are the only option for people to call to go out and give these people that help. So I don't know how you would even structure that, but fortunately, people like Bo and my police department and many other police departments, we've been trained. We understand the other resources that are out there. So we're always going to be that point of contact. And then once we make contact, we turn it into a problem of another agency who does have more resources and understanding and the ability to help that individual. But we are always going to probably respond first. I just don't see a way around that, unfortunately.
Yeah.
What I would add to that, in DC, we have outreach organizations that work on a daily basis with the street homeless. And in conjunction with that, the outreach workers also have a relationship with the police department and our mental health agency, to direct services to those individuals who are on the streets, and certainly, to help those individuals to get the help that they need, whether it's immediately shelter, for the night, or long term, to get them into permanent housing. But outreach is a very key and essential part of our system in Washington, D.C.
Yes.
Yeah. And I would just add to that, for communities that may not have as many resources, like DC has, a robust set of resources, but for areas that may not have, sort of urban city resources, or large county resources, there are different practical ways to begin the process of cultivating relationships and brokering meaningful partnerships between the justice system, law enforcement, the courts, homelessness providers, behavioral health partners. I'm glad that you spoke earlier. You and Tanisha spoke to the co-responder model. I spent 6 years in Arlington County, Virginia, working on homelessness there and leading their system. And they do use the co-responder model, which is an incredibly effective way to shift the burden away from law enforcement and over to behavioral health, where they've received adequate training to know how to respond to folks with serious mental illness. And Hopsy, you mentioned earlier SAMHSA. SAMHSA also provides funding for path workers, and these are folks who have dedicated training and specialize in, dealing with co-occurring disorders, severe pervasive mental illness, and they focus solely on the homelessness population. So there's an opportunity there. If your community doesn't have a path program or path workers in it, find out why not. Challenge your community, right? If you're a constituent, challenge them to bring that resource in, especially if you are experiencing high pockets of unsheltered homelessness. Because I can guarantee you there's a resource for almost every area of homelessness if you have the folks that are willing to look for the resources and bringing them into the community, because I do agree that this is homelessness is not a law enforcement problem. It's a community problem. It's very much a social issue that is impacted by multiple sectors. But again, it's solvable, and we see communities reaching a functional end to homelessness for certain subpopulations. So I would just challenge you, for those of you that are attendees, call out your mayor, call out your council member. Let them know that law enforcement shouldn't be alone in dealing with homelessness, because it's not their responsibility. It's community responsibility that requires a community solution.
Yes.
And if I could say one challenge that we've run into so often regarding the homeless and the mentally ill, once again, is the public perception of violence and dangerousness. That individuals who have mental illnesses or homeless have a huge impact on violent behavior. We know statistically that individuals with mental illnesses are no more violent and dangerous than the general population. Matter of fact, they're 11 times more likely to be victims of crimes, let alone be perpetrators of crimes. You double that in the homeless population, where law enforcement oftentimes gets called because you have someone who's been a victim of an assault, victim of a homicide, victim of a robbery, and those are just the ones that are reported, which are very, very seldom. And so not only is it a housing issue in regards to getting individuals places to live, a lot of times it becomes a law enforcement issue when we're responding to serious assaults of just robberies and things that are just happening. It becomes, if we're responding, trying to help individuals who are being victimized far more than anything else. And that's a very difficult challenge where we have to face that as well too.
Yes, Eric, thank you for mentioning that. That is so important, and there's such a misconception about violence and mental illness. Thank you. We have 2 minutes left for one more question, and we're gonna, let's see, Elizabeth Wallace is our viewer asking, do you think that assault of a police officer should be more loosely defined if the assailant has a mental health concern? Big question with 2 minutes left. Anyone? Sergeant Dahl, I don't want to just put it on you. Would you like to respond to that question? Or anyone else? That's a tough.
I mean, I'll keep it real brief. I mean, you're always going to have to address these issues, but I mean, I think a lot of times in court and, you know, the officer reports, you've got to understand the why something is happening and address the issue of why, not just what happened, but why it happened. And I bring this up, and I know Bo could really talk on this. When we make an arrest of a homeless individual, it is a cry for help to the criminal justice system to please help this individual. We're not trying to put him in prison. We're not trying to give him a criminal record. We talk to him over and over again. We try every resource possible and every means possible. And ultimately, we're stuck. We run out of options. So we want to get them into programs like Bo talked about, where they're forced to go to drug treatment. So that is a lot of times where the arrests come from. It's just a cry for help. It's not us trying to be mean to the homeless. It's just us crying for help, like saying, please help this individual. I don't know what else to do. I'm stuck.
Mm-hmm. Thank you, Sergeant.
Right. And Sergeant Dahl is right.
Oh, okay. You said,
you know, Sergeant Dahl is right. We are more, the homeless resource unit and myself, prior to this pandemic, we are more in the courthouse, both criminal and marchman. If an arrest needs to be made, we are right there the very next day advocating to get that individual some help, or getting the judge to go ahead and work with us, and we would then follow up with shelter or treatment placement, relocation placements with our local outreach team. We are teaming up with once a week, and we've been doing this for 2 years now with our PATH team, addressing those severely mentally ill individuals on the streets of Miami Beach. So we're always looking for different ways.
And training is everything, and I really recommend all of our civilian viewers, please do a ride along. It will transform how you see law enforcement. I want to thank our panelists today. I want to thank all of our mental health professionals and our law enforcement. Stay safe out there.
As our panelists explained, the issue of homelessness is one that affects all of our communities, from major cities to small towns. A common thread for most of these communities is the fact that law enforcement officers are often called upon to solve the issue of homelessness. But as our panelists have also explained, the best way to create positive change for communities regarding the question of homelessness is through collaboration and compassion. Hopefully, with the information shared by our panelists, you can take some practical ideas to your own communities. Thanks to our moderator and panelists who brought this important conversation to life. And as always, thanks to Anna Muckenfuss, our Manager of Programs and Education Initiatives, for helping write today's program, and Christopher Mitchell, our Manager of Digital Content and Strategy, for producing. And thank you for listening to this episode of Encore, a Precinct 444 podcast from the National Law Enforcement Museum. We hope you enjoyed Crisis and Homelessness Intervention Strategies, and that you'll join us next time for another look back at some of our best programs from the past. Please subscribe to Precinct 444 on your favorite podcasting platform to stay connected and to receive our latest content as soon as it drops. And we would love to hear from you. Send in your questions, comments, and feedback to precinct444@nleomf.org. You can help us make our content even better. The National Law Enforcement Museum is located at 444 East Street Northwest in Washington, D.C., and is dedicated to telling the story of American law enforcement. We expand and enrich the relationship between law enforcement and the community through educational journeys, immersive exhibitions, and insightful programs. Find us online at lawenforcementmuseum.org. Until next time, stay safe. We'll see you at the precinct.